Welcome to The Lowdown, the newest podcast from Belden Communications, hosted by yours truly, Wayne Belden, president of Belden Communications, and co-hosted by my son, John Belden, vice president of Belden Communications. Listen on the first Friday of each month to The Lowdown as John and I chat and get candid with those in the know about the hottest issues affecting all of us in Volusia and Flagler Counties. We'll sometimes get loud and sometimes hilarious, but always educational and informational about the challenging aspects of issues facing us all. Which topics will we cover and who will be our guests? You'll just have to listen to find out. You can hear our podcast on your favorite podcast app on the first Friday every month at 2 p.m. Be sure to tune in because whatever topic we're covering, we'll be giving you The Lowdown. Welcome to The Lowdown, a podcast created with you in mind. As I said in the open, it is our hope to bring you The Lowdown, your need-to-know podcast, on the first Friday of each month, where we talk about the hottest issues with pertinent guests that affect all of us in Volusia and Flagler Counties. We hope to be able to have guests on our podcast with direct influence on the issues at hand and get something done, or at least help get issues resolved. So let's get things started by introducing my co-host, my son, John, who is Vice President of Belden Communications. John, welcome to The Lowdown. I'm happy to have you as my co-host, son.
You know what? It's a pleasure to be here. I'm happy to be the co-host. We're going to have a lot of fun. With us also today is our producer, Phil Bird. How you doing there, Mr. Phil?
Hello, everybody. I am happy to be here. Thanks for having me, guys.
It's going to be a lot of fun. Today's podcast, guys, is actually brought to you by Countryside Lakes in Port Orange, Florida. Countryside Lakes here in Port Orange has been tried and true for 35 years. When you live at Countryside Lakes, you love living resort lifestyle. There are many amenities here at Countryside Lakes, such as year-round swimming pool, a putting green, which for all those golfers, ample outdoor seating, a pondside dock, and gardening opportunities if you've got that green thumb. One amenity that many listeners will be interested to hear at Countryside Lakes, it offers physical therapy solutions on site, which is actually fantastic. Residents can participate in all types of rehab, such as orthopedic, sports rehab, geriatric, balance disorders, and lymphedema. I got that right. Help check that out, Phil. Learn more at the independent living and assisted living amenities that Countryside Lakes has to offer at countrysidelakes.com. And
I'd love right at this time to introduce our guest, Dr. Kenneth Hawthorne, who is with the you're the owner of the Hawthorne Orthopedic Clinic. Is that correct?
That is correct, Wayne. It's great to be here.
I'm excited to have you. And one of the reasons why we decided our very first podcast to be about knee replacement is because, as you know, I recently had both my knees replaced by you, and I was so pleased with how that procedure went. And I also, John and I both get up early in the morning and we work out at YMCA. And in the last several years, it seems to me like there have been countless numbers of people that are walking around in pain with knee replacement. And when I tell them about my knee replacement, they saw me just 2 weeks after I had my surgery done. I still had my bandaging on. I shouldn't have said this because he didn't know that.
I know you're going to get in big trouble.
I'm going to get in big trouble. I shouldn't have been doing that, but I was doing it. And they were all asking me, where did you didn't have to go in the hospital? Where did you get that done? Yep. So, and I told them all about Dr. Hawthorne. And so hopefully I've sent a lot of people to you.
Everywhere you go, you're telling people. I mean, we work out at the YMCA. There's a lot of people there with knee pain. And he was doing the bicycle very quickly.
Have you seen Wayne play basketball?
Oh my gosh, this man can run. Let me tell you,
he puts me to shame.
Wow,
he's fast. He can jump too, right?
But I saw white guys can't jump, man.
You can, but he was doing the bicycle.
I wasn't going to say that.
I was amazed to see him the way he was doing it with ease. It was very impressive. So.
Well, Wayne worked hard at it.
He did, right? He has that tunnel vision that we talk about, singleness of purpose. And he would tell me every day, he goes, I'm not going to let this beat me. And man, he beat the heck out of it from jump.
Yeah, he was having a hard time walking before.
He was. And I think this is an important thing to bring up, and then I'll shut up if you don't mind. But this was something that he needed to do for a number of years. And as his son, I would see him walking in pain. And everywhere we went, he was limping. If we went to go do a set of stairs, he would stop. He'd huff and puff. And he tried all these other things because he was scared before he learned about your procedure. He didn't want to have knee surgery because he was scared he was going to go in the hospital.
Yes, it's very scary, especially with COVID and going in the hospital and afraid you're going to catch something. And
Absolutely.
they say that the hospital is a very dangerous place. Lots of unintended consequences happen in the hospital.
Right.
So the outpatient surgery, that's the way to go for everything if you can.
Yes.
My wife is here with us, and she will tell you I tried every topical cream known to man. All those braces that you see advertised on during the Andy Griffith Show, and all of those, all those braces. I tried all of those things. Nothing helped. What convinced me to finally go and get this done, oddly enough, was my cardiologist. Wow. In 2013, I had open heart surgery, quintuplet. I had 5 arteries replaced. Is that it? Quintuplet?
That's a big word. It sounds
I had 5 of them replaced, and every year I would have to go and get a checkup with him. And he was concerned because my blood pressure was rising, and he says, "Are you in some kind of pain?" I said, "Yeah, my knees are killing me." And I told him, I probably need to get knee replacement. He goes, "You better go get it done because I cannot increase your dosage of the blood pressure medication. It's already as high as we can go. So you need to go and get this done and get out of this pain." And I did, and my blood pressure is absolutely perfect now.
Yeah, the walking is so good for you mentally and physically. Mm-hmm. And if you can't do it because you're in pain, it's pretty sad.
Right.
And a lot of people, after they get their knees done, they start being able to lose weight, and they feel better, and they actually get off of their high blood pressure medication.
Makes sense because they're moving.
Yeah, and they lose weight because they're moving.
Yeah.
It's amazing what happens when you lose your mobility. It's a terrible thing.
Yeah, mentally, that's a tough thing.
Right.
And again, I watched you from one side to the other, and it's amazing now.
I mean, even I've seen it. I mean, when we first started doing our show, we would have to go up some stairs, and that was hell on you.
Now I look for stairs. I can't wait to try.
He can outwalk me speed-wise. I'm not kidding.
I don't doubt
He's a
it.
speed walker, and it's 4 a.m, so maybe I'm a little tired, but the man can outrun me.
On your left.
Yeah, it's seriously.
I am obviously you could tell I'm very impressed with Dr. Hawthorne.
Yes.
And I'm not. I'm pretty hard on doctors.
Yeah.
Okay,
but a lot of them have blacklisted you, if I'm not mistaken.
Well, you ask a lot of tough questions. That's why.
He's good though. He did his research on you before he even called you. I mean, definitely we looked it up.
Right.
I thought somebody was following me.
Yeah, he was. We were in the bushes.
Is that Wayne in a bowler hat?
Yeah. It's like
Before we really get into this, let's talk a little bit about your credentials because you've got a lot of them.
Sure, I do.
Yeah, I mean, I'm a big sports fan. So when I look and I see that you were with the Colorado Rockies Major League Baseball team, wow, that's to me is impressive.
What position did he play?
Doctor.
Oh. Okay, good.
Good
that's
one.
Funny.
Good one, Phil. He was the University of Colorado with the football team. Okay, he was the University of Colorado Athletic Department, United States Ski Team, the Big 8 Conference Cross Country Championship, American Downhill Skiing Championships, the Denver Public High School Athletic Department. You were also with the PGA Tour. Is that correct?
Absolutely.
Wow. Man.
I mean, folks,
Yeah,
I got 3 pages of credentials here, and that's the reason why I went to this man.
Yep.
I said, this guy is working on all of those people. That's where I'm going.
I think you're the most prestigious client he's had yet, too. I heard.
Well, when I believe in something, I believe in you, and I've been passionate about you your whole life.
Oh, thanks, Pop. So I get the day off tomorrow is what you're saying?
Only on your birthday.
Yeah, all right.
And you've had 5 birthdays already this year.
yeah. Well, I gotta get it in when I can, right?
It's amazing, folks. So as of those of you listening, you can probably tell there's people in our audience here today. We're thrilled about that. But I just want to share with you, John, that it's a real pleasure for me. I'm very proud to have you sitting here with me. I remember bringing you home from the hospital in a little blanket when you were about that big. And now to have you, 40 years old, sitting here.
39.
Okay. You and Jack Benny.
That's right.
Okay. To have it makes me feel good. It's been a lot of fun.
I appreciate it as a kid. My father was in radio for 30 years plus, and I always
If you couldn't tell.
And as a kid, I always wanted to get into radio. So this has been a lot of fun. So we have a lot of fun meeting guests like yourself, and we learn a lot too, which is incredible.
Right. So
learning is important.
It's very important.
let's get into your procedure that you do. You did on me, and I guess on everybody, what's known as a visionaire.
Yes.
What is that?
The visionaire is very visionary. And that's how it got its name.
That's a good name. I like that.
Visionary. And it's a product of Smith & Nephew. It's a British total joint company.
Okay.
And they came up with this brilliant idea of having a computer do a virtual knee on you and then take that information and give it to the physician, the surgeon, like me, and then use that information to do a perfect knee replacement on you.
I like that, the perfect knee replacement, and that's so important because it does it, right?
What exactly does a perfect knee replace? What do you mean? Is it same measurements as to what you already have?
Right. So it starts with artificial intelligence. So we get a 10-minute MRI scan of your knee, and then we send that information to Smith & Nephew. And they have a supercomputer that has artificial intelligence, and it does a virtual knee replacement on you. And it takes all that information and it condenses it into these cutting blocks that we use in surgery that we put on you so we can shape your knee so the knee is shaped perfectly.
Wow. I mean, that's incredible.
So are you actually physically doing the surgery, or is like a robot doing the surgery?
It beats the robot because the robot is not as smart as the supercomputer.
The operator.
Right, not as smart as a supercomputer.
Wow.
So the surgery is essentially already done perfectly before we even start.
Wow.
So and it allows me to make a smaller incision. It allows for me to cut less tissue, and it allows for complete accuracy.
So some would say it's less abrasive then.
Yes, it's a minimally invasive technique.
Wow.
And so when you get the cutting blocks that the computer made, you put them on the knee, and then you just cut along the dotted lines.
Wow. The technology is amazing, right?
That's it. And then we put the prosthesis on, and then we close it up, and we're done.
I mean, my father's always said computers are an amazing invention for this country, and that's just another reason as to why.
It is, and it saves time in surgery. It decreases blood loss, and that is what allows us to do the outpatient surgery. So, Wayne came in to the surgery center at 7 a.m. We got him ready for surgery, took him back to the operating room. He went to sleep. We did the surgery in an hour. He was taken to the recovery room. Took him an hour and a half to recover. He went home.
Wait, hold up. You said it was hour surgery and then an hour and a half recovery.
And I'll tell you something else.
And then you went home.
Right.
Yeah.
And I walked in my front door of my house.
Right. We got him walking after I do the surgery in an hour. It's an hour surgery because of all the fantastic technology that we use. And then they recover him, and then we get him up walking right there.
Can you imagine that?
Yep.
Hour and a half after surgery, he's up walking the halls.
When he told me, he was there when I woke up. He was standing right there. And he said to me, he goes, "Come on, Wayne, we got to get you up." And I looked at him, I said, "Get up? I just had knee surgery. I can't get up." He goes, "Yes, I know, I was there."
I participated.
I couldn't believe it. They wanted, but they also, another reason they wanted to get you up is because they don't want you to get pneumonia. Is that true?
Well, yeah. If you're able to get up right away, that decreases the chance of blood clots and problems with your lungs.
Right.
So Wayne got up right away, and he started chasing the nurses around.
My wife's here.
Yeah, be careful.
Around the recovery room, we had to put him back in bed.
Mr. Belden, go back to sleep.
Thanks, Doc.
We almost had to put restraints on him.
That's funny.
I'll edit that out.
Yeah, please.
Yeah, the replay.
Yeah, because this is going to run over and over on the internet. I don't want anybody hearing this.
Yeah. Oh my gosh.
Maybe my ex-wives would, but
It's your third marriage, but this is the best. Yeah, this is great.
Yeah, but who's keeping score?
Takes practice.
That's
Right.
It does.
So one of the things about this, and which you've alluded to, is that there is a lot less pain involved, and I found that to be totally true.
Yeah, it's amazing because I would say 50% of the people never use pain medication other
I never used it. Never
than
once.
other than Tylenol, and then they get a nerve pill to take that kind of deadens the nerves, but no narcotics. So you don't get the constipation from the narcotics. You don't get the nausea from the narcotics.
See,
you don't get the fuzzy head from the narcotics. So that really helps you do a lot better than the old way.
So for those of you that are listening right now, because we had a lot of people that reached out to us before the podcast, we've been promoting it online with questions, and we just told them, like, you got to watch. But for those of you that are putting off this procedure because you're worried about going in the hospital, you're putting off the procedure because you're worried about the after effects, the pain, 50% of people that have this surgery are on no pain meds. That's huge. Don't wait anymore. Get this procedure.
There is no reason to walk around in pain. There is none.
And we see them all the time.
Right.
And they walk very slow because they're in pain. I mean, this is life changing right here. What you're doing.
Yeah,
it's incredible.
It is life changing. It's it's scary going into the hospital, and then you get all drugged up and you feel lousy.
Yeah.
But there's an alternative to this: the Visionaire, the custom fit knee, outpatient surgery, and no narcotics, and recovering quickly. So a lot of people get back to driving in 2 to 3 weeks, and they're back on the.
When I broke my ankle, it was a lot longer than that. I mean,
Yeah,
that's
I was driving real quick. My wife was not happy with the fact that I was going to go out and drive as quick as I was, but I was fine.
Well, she's seen you drive. That's the thing.
50,000 unemployed comedians, and you're telling jokes.
Hey, man, that's apple don't fall far from the tree, huh, Pop?
Yep.
All right.
Yep. So, is there anything else that we need to cover as far as this surgery? I know there's a lot of people out there that, like I said, friends of mine that need knee replacement, and my God, they're afraid. They hear about blood clots, they hear about infections, they hear about all of this stuff, and
the nice thing about doing the Visionaire and it allows you to do a surgery more accurate and also more quickly. So your wound is not opened up as long, so there's lower chance of infection, and then you also recover quicker. So you shouldn't be afraid of this surgery, because in a couple of months after you've got it done, you're able to get back to the tennis court, on the golf course. You can get back to swimming, you can ride your bike, and really people turn the corner where they're ready to do things. I have to at about a month, I have to hold them back.
Right. Yeah. Now you actually encourage the swimming too, right? Swimming is good.
Swimming is.
I did the swimming.
Yeah, I remember
at the YMCA.
Swimming is fantastic for you.
So, is there a minimum, or I guess, a minimum age you have to be to get this done, or is it really a required? Like,
if you have a bad knee, you want to try to get to the age of 50.
I have a question though.
So,
what actually constitutes as a bad knee?
Pain. Right?
Pain, and the knee is coated with a surface. It's a spongy surface, and you can think of it as Teflon, and the Teflon flakes off, and that is what arthritis is. It's the spongy surface of your knee, which we call articular cartilage, which flakes off, and then that makes it so your knee, your bone is exposed, and your bone has nerve endings in it, and when that gets exposed, it's like a bad tooth.
Yeah.
And it causes you a lot of pain.
I had in high school 3 knee surgeries, and I had to get a cartilage implant from a cadaver, and they told me at some point I'll be in a lot of knee pain and need a knee replacement. So good to know that Dad was the guinea pig, and it worked well. So thank you, Pop. So
could you refer to me in another way other than a guinea pig?
Guinea pig, okay. Well, I didn't want to say test dummy.
But I'd rather be a guinea pig.
Right? Exactly. I thought that was a lot of people love guinea pigs.
Where did I go wrong?
Remember how much you love doing this with me, but honestly, it's great to see that it works so well, and so I know you're going to be doing this for many more years. So it's great to see something like this is around.
Yeah. Yes. I had my right one done first, and then 6 months later had the left one done. Is there anyone that ever gets both of them done at the same time?
You can get them done at the same time. It's just it's a little bit harder process, and because of that, I recommend you do them one at a time.
Yeah, I would think so. So you have one that you're not just brand new having surgery done, so you can kind of, I don't want to say give more weight to that, but you get my point.
Yeah, and especially since it's not as a scary surgery now,
Right.
And you recover a lot quicker. In the old days, when you went to the hospital, they do both at the same time, so you could try to avoid going into the hospital 2 times because
Right.
the hospital is a dangerous place.
Yeah, it can be.
So
For sure.
yeah, they've done studies on it.
Right.
So the outpatient surgery. It's so quick and easy. You get one done. You really don't miss much in your life by getting that done, and then you just go and get the other one done. So it's quick and easy. Best way to do it outpatient, and with the Visionaire, people love it and they do really well.
I actually, people could think I'm crazy when I tell you that I actually enjoyed the whole procedure, the whole experience, and I look forward to getting the next one done. Also, I want to give credit to I forget the name of the company that you guys use. When I got home from the surgery, both the nurse and the physical therapist were there at my house waiting.
Yeah, Medisys.
Medisys?
Medisys. They do a great job.
Oh, they do a fantastic job. And the physical therapist came Monday, Wednesday, and Friday for 2 weeks. And I did all my therapy with him. And then, of course, on my own, because he left pages of the stuff so I can do them by myself.
And that's another misconception of knee replacements, especially the Visionaire in the outpatient surgery, is that the therapy is so hard and difficult and painful.
No,
so it's not. And a lot of people will do the therapy at home, and basically it's just moving your knee and doing strengthening exercises that don't hurt very much. And you do it in all the comfort of your home.
Oh,
and most people don't need to do outpatient therapy. They can do their exercises at home. Some people like to go to an outpatient physical therapy center after they've done 3 or 4 weeks at home, but a lot of people skip that and just go to the gym and do the exercises that they learn. So it's not a big burden anymore about therapy. The therapy almost comes naturally.
He loved. There was a part, and you always.
I'm going to get to that.
Okay,
I was going to get
favorite part.
That was the range of motion. What do you call that mechanism?
The CPM, which stands for continuous passive motion.
I looked forward to that. You put that on the bed, and then you lay down.
Whoa. Is that like a swing?
Yeah.
No.
G-rated, man. G-rated.
No, Phil, you got the wrong thing. We're on that's a different show. Okay.
Cover your ears there.
Watch yourself.
Okay.
So you lay down and you put your leg in it, and the foot portion of it comes toward you and makes you bend your knee.
Yes, and it's a very nice device, and everybody who has a knee done by me gets one of those machines to use at your home for 3 to 4 weeks.
It was fantastic. And then when you're done with that,
This is the part.
I love this machine. What was that cooling device?
The ice machine. So the ice machine prevents swelling, and it also helps control discomfort in your knee. And you can use that as much as you want.
How cold does it get?
43 degrees.
Very cold.
Man, you imagine 43 degrees on your knee.
43 degrees.
Kristen
But
saying no.
it felt so good.
He loved it.
Oh, I wanted to buy one from the guy, and he said they didn't sell them.
That's very therapeutic.
I mean, yeah.
Is that true that cold is better than heat when you have the pain?
Yes.
Cold is always better than heat.
See, I didn't know that.
Yeah. If you have inflammation, you should put cold on it. Everyone thinks you can put a heating pad.
Because they put heating
It's the
pad.
wrong thing to do.
My wife's got a really bad back, and so she uses a heating pad. And yeah, that's what I'm hearing is that the cold is actually better than the heat, right?
Correct, but except for the back.
Oh, except for the back.
So your wife's got it right.
So she's right again. Is what you're saying.
She's right again.
She's always right.
Always listen to your wife.
I'm sure she's listening right now going,
You're still on your first wife, right?
Yes.
Okay, keep it going, boy. Keep it going.
It's the only one I can afford at this point.
Just,
Keep listening.
learn from me. Keep your mouth shut and do what they say.
Yes,
and,
that's
happy wife, happy life.
Yes, ma'am, honey.
I finally figured it out, right, Mary Beth? You better say yes.
Oh, my goodness.
So, what else?
Yes.
The surgery is available here in Volusia County, and love to give you a new knee.
Yeah.
I'm still shocked.
And he'll do it.
I'm still shocked that he said there's no medication needed. Like, I'm reaching for a hydrocodone for a paper cut.
Yeah, no kidding, right?
Yeah.
No kidding. I mean, and there's a lot of people, too, again, are very nervous because, a lot of people, that they don't want to take certain medications. So the fact that you can have this procedure done and you don't have to take, you're not going to be, I mean, look, everybody's body is different, right? But you're saying 50% of people don't even take outside of maybe like a Tylenol.
Correct.
And so there's a lot of people, I learned with him because he had open heart surgery, there's a lot of things he can't take anymore because of that.
Because, like I can't take NSAIDs, which is a non-steroidal anti-inflammatory drug.
So there's a lot of people, and in all due respect, you did it. You put it off for a lot of years because you kept giving yourself excuses. There's no excuse. There's none.
Yeah, there's no excuse. You should get it done so you can get back to the things you love to do. That's why I became an orthopedic surgeon. Is our goal as an orthopedic surgeon is to get you back to the things that you love, walking and playing golf and tennis. And there's no reason to be in pain with your knees when you can have this great technology that allows you to have the surgery done in an hour and then go home after the surgery, get all your therapy at home, and then be back to all your activities without pain in a couple of months.
Yeah, I can't emphasize enough that this is such a simple procedure, and I would encourage anybody that's walking around in pain right now to go to Dr. Hawthorne and get this taken care of.
If you're going to walk somewhere, walk to Dr. Hawthorne's office.
Yeah,
that's where you go.
Right, exactly.
So what other surgeries do you do? So you do knee surgeries, but you do other...
Do hip surgeries and shoulder surgeries.
Okay, so like the hip one is another one that a lot of people are scared of doing, right?
Right. We do that. We do that outpatient now too.
Are you serious?
Outpatient hip surgery?
Yeah.
Like, what?
We have somebody in the audience who was telling me they need to get hip surgery.
Wow.
I don't know who it is, but
They're going to be quiet now.
they were telling me, they probably don't want to raise their hand now.
But you do hip surgery and it's outpatient.
Yes.
And you're walking?
You're walking just up, but just like
Wow.
just like with the knee, Smith and Nephew has a great technology for the hip too.
See, I had I was born a man. I was preemie 6 weeks early, so I had
Yes, he was.
hip dysplasia.
Oh, really?
Yes, and
But
so,
you've been late to everything else for the rest of your life.
That's right. I know. Well, I'm getting better at it, though, right? But again, they told me that at a certain age, I'll be screaming for hip replacement. And I'll tell you, as a young person, or young-ish person, that I always said, I'm never going to get a hip replacement. I don't want to. Because, you hear horror stories, the people that really can't walk after the procedure,
Absolutely.
the pain. And so they told me, they said, listen, because, I was active in sports and all that. So they said, when you're in your 50s, 60s, you're going to be begging for it. So you're telling me that technology has come such a long way again
Absolutely.
on a hip replacement. Wow, that's
Right.
incredible.
Then we do shoulder surgery, rotator cuffs, I do arthroscopies.
Do you have an office that I could just move in over there? Because my goodness, that's
Yeah, let's talk about where you're located at, because you have two offices. You have one in Ormond Beach.
I have one in Ormond Beach that basically is at Nova and Granada.
Okay.
And then I have another office in Port Orange, which is basically at Dunlawton and Clyde Morris.
Yeah.
Okay.
right out very
You're two
accessible.
buildings over from the Walgreens there.
Yep, and we share a parking lot with Walgreens.
Right.
So
Right.
you can book your knee surgery and then go shopping.
Right. Absolutely. It's almost that simple.
It is.
It's almost that simple.
It is.
One thing that I want to emphasize, particularly to those people that are listening, as with any recovery from any surgery, your success rate is going to depend largely upon you and how much you want to put into it. Because the people that I've talked to that have had the knee surgery and are sorry that they did it were also the same people that didn't like to do the therapy because they felt it would hurt, it was pain, this and that. There are some things that you've got to work through.
Yeah.
Well, that's very true. But the nice thing about the Visionaire is that there's less pain, and that allows you to do that therapy.
Yeah.
So, but you're right. If you don't do that therapy, you end up with a lot of problems. And that's what's so nice about this technique is that we get the therapy going right away. And you have the machine at home, the CPM, to help you move the knee. You get the ice machine to cool down your knee.
Yeah.
And this all allows you to be able to do the therapy, because if you're in a lot of pain, it's difficult to do the therapy. So
and you're
now,
you'll be in less pain with the procedure than you are now, right? I mean,
right. And so that now with all this new technology, you have less pain when you do the therapy, so more people can participate in the therapy.
Right.
Now, Wayne was an outlier. He was just incredible with the therapy. I mean, he could probably be a physical therapist now.
He's always been a very strict a stickler when it comes to directions and things like that. And he's like, nope, this is what I have to do. And he doesn't let anything get in the way. And I'm very, very proud of that, of you for that.
Thank you.
If I can get a third of that, I'll be a very happy man. So he did it. And plus you guys have, what was it? Didn't you have a physical therapist come in there?
Yeah.
For like the first week or two, too. I mean, so you had so much help.
Yeah. I had the surgery on Friday, and the physical therapist was there at my house when I got home.
Right.
And then he came back on Monday.
Yeah.
And that's when the physical therapy started.
So, yeah, it's a great
so
setup.
it was a very enjoyable time, and I enjoyed working with him. His name was Mark. He was a great therapist, and the guidance was there. Everything was just absolutely perfect. And you know what I was really impressed about? I had the surgery on Friday. Saturday and Sunday, I started doing my own therapy in the house, and then Monday the physical therapist showed up. But you know what the worst part of the whole surgery was for me? Now I'm saying this to him, and he's shaking like, what's he going to say?
Yeah.
The worst part was the bandaging.
Oh, yeah.
Oh, yes.
That was the worst part to me.
Yes.
You know? And then I showed up at your place on Monday because I had an appointment with you, and you took care of that.
Yes.
I mean,
so you get a light bandage over a big Band-Aid, and once you take off that light dressing, then you just have a light Band-Aid over the wound, and it's a special bandage that stays on for 3 weeks, so you don't have to fuss or worry about the wound.
Yeah.
And it's impregnated with silver, so it keeps the infection away. So it's a very high-tech bandage that you wear underneath that big wrapping. So once we take that big wrapping off, a couple days later, then you're off to the races, and you've got this special bandage that protects you from infection.
Now, you didn't do stitches. What did you use? Glue on me?
We
Elmer's.
used
Elmer's glue. It's cheap. It's easy at the store.
Yeah, it is cheap. Elmer's water soluble, though. That would have been a problem.
Oh, gotcha.
No,
Okay.
we actually use a super glue. It's the same.
Gorilla Glue.
That's right.
It's the same compound as super glue.
Really?
It's actually super glue.
But it's safe for the body.
Yeah,
Wow.
I don't know how they make it sterile, but they do.
That's something.
And then there's a little stitch underneath the skin too, and that stitch dissolves.
You know, that's something else too we should touch on, because a lot of people, when they see your scar, is very minimal.
No,
I can't even
it's
see
hard to even see it.
So that's another great thing, because a lot of people over the years have had surgeries back in the day, especially they were very, very abrasive and very big, and there's all types of reasons. Everybody has a different reason as to why they don't want the surgery, and that's another one. A lot of people I don't want a big scar. It's very minimal.
Yeah,
Well, I've heard all the excuses, and I'm just going to tell you, come out and say it. The big reason is they're just chicken and scared. Yep. And I found after I had the surgery, I felt like a big baby. I said to myself, this is what I was scared of?
Yeah.
This was nothing. It was a piece of cake.
He was mowing the lawn, and I don't know if he was
Oh, yeah.
and he's got a fast mower, and I'm like, what are you doing? But
Was he wearing those shorts?
I was.
Was he wearing those shorts?
Within 2
He
weeks,
was
I
wearing
was
shorty
mowing.
shorts.
Yeah, I hear that. I hear that. The people really are out there
He's got
pretty
thick
active.
St. Augustine grass.
Oh my gosh.
And I said, what are you doing? But he felt like $1 million.
Yeah, sinking that stuff.
Man,
Yeah,
let me tell you.
yeah, it's very thick.
Yeah. And he was, I'm telling you, he's fast.
And my wife was furious with me. She said, what are you doing?
Yeah, I know.
I said, I'm going to mow the grass. She said, you shouldn't be mowing the grass. She said, I'm going to call Dr. Hawthorne. Yeah. And that was another thing. When I left the surgery center, Dr. Hawthorne gave me his cell phone number,
We're
so
gonna put
that
it
if
on this-
I had any problems at all, I could reach him. I don't know if too many doctors do that.
We're going to put it on the screen here in a minute. If anyone wants to call or text him, go for it. His personal line.
Wayne, I found that the patients are really good. Now, I've been doing that for a long time, and with the technology of the phone, they can just text me. If they have any questions, it takes me, 3 or 4 seconds to answer them, and it's very efficient. And I really want to have good communication with my patients. I want them to feel confident that they can get a hold of me right away, and they can using the text messages. And you have my cell phone. I never received a text from you.
Yeah, he was texting me.
Everything was going, yeah.
Call Dr. Hawthorne for this. But another thing too is we hear so much great things about you around town. There's a woman that we actually work out with at the gym that you more or less helped put her back together after a motorcycle accident.
Sharon.
Yeah. Oh, yeah.
Yeah.
Oh, yeah. I know Sharon.
Yep. And
Yeah.
so
that was a bad bike week accident.
Yep.
but all you have these procedures that are, and you wouldn't know anything was wrong. I mean, seriously, she walks, she does all the machines, and she's
That's fantastic.
Yeah, she does great. We've been sitting here talking. We need to thank our sponsor, who's allowing us to have this here tonight. You want to tell us about
My pleasure, guys. The Countryside Lakes, once again, our podcast is sponsored by Countryside Lakes in beautiful Port Orange, Florida. And actually, the residents at Countryside Lakes choose to live here because they love living a resort lifestyle. Residents can choose from either independent or assisted living accommodations, both with personalized care and services by experienced staff. Countryside Lakes offers spacious 1- and 2-bedroom apartments, which have all-inclusive amenities, lots of daily activities, and entertainment. Matter of fact, they were doing axe throwing here recently. Yes, axe throwing. It's special axe throwing, but it's absolutely fantastic. Look very difficult to do, so come try it. They have on-site physical therapy clinic, doctor's office, and a beauty salon. So really, everything for you to make it a resort lifestyle. That's right. She loves it. There we go. Get the round of applause. We got some beautiful hair down over there. So if you're ready to start living a resort lifestyle, you should log on to countrysidelakes.com and set up a no-cost obligation consultation for you or your loved one. We also today, guys, we'd like to thank our guest, Dr. Hawthorne. Thank you so much for coming out today. We've had such a blast with you.
Yep, this has been, one of the things I did want to touch upon that was very important to me when I first came to you and you said to me, Wayne, you are bone on bone and you need this surgery. I'll never forget that. But the thing was that I was watching you carefully and you exhibited to me ultra confidence. And that's what I want to see in a doctor when I'm going to have surgery. Yeah. And you had a lot of confidence in yourself, and that meant a lot to me. And so the other part of it was, all through this whole thing, I knew what to expect because of the way that you had presented to me. And I think that's very important. And I want to dwell on that a little bit for our people that are listening that are still fearful of having this surgery.
Yeah, so communication is very important. And we don't rush you into having surgery. There's things we can do to help you with your discomfort before having surgery. And so we will always want to try those things first. And we always want to make the patient feel comfortable and actually enthusiastic to get their knee done.
Yeah.
And you can't really talk somebody into a knee replacement. They have to be ready for it and excited to get it done. And then once you get it done, my office is there to support you in the surgery center of Volusia, where I do the outpatient surgery. They're very good at supporting you and looking after you once you've had your surgery. And Medisys provides great home health care for you. So we have a whole team of people that want to take care of you and make you comfortable.
Yep.
Now, the surgery center is right there on Clyde Morris and Reed Canal, is it?
Yep, between Reed Canal and Big Tree.
Right, and I was very impressed with how I was taken care of there when I walked in, and boy, a whole team got on me. I'll never forget that. And they were
You bragged.
spot on. I mean, they made me feel so comfortable, and they're trained because they're expecting you to be a little nervous and a little bit apprehensive and all this, and they were telling me jokes. The whole procedure for me was excellent. Excellent. Everything, right down to my last appointment with you when you told me, okay, you're good for 30 years. See you at 106.
That's right.
110.
110. So
110.
now you've got a commitment to stick around for 110.
Right. Is there anybody in the audience here that has any questions? If so, Kristen's got a microphone. You can ask any questions. If not, don't be shy. If you don't,
Yes.
he's got one.
All right.
We have a gentleman here up front.
What's
My
your name?
is Bob. I'm anticipating having knee replacement. I have two tears on my meniscus in my left knee, and I have a consultation on the 17th to discuss possibilities. So I was just wondering, does this procedure take care of meniscus things, or are you just replacing the meniscus stuff would just come out and you'd have a new knee?
Yes, the meniscus are usually torn when you need a knee replacement.
Yeah, I have two tears.
Yeah, so usually that's what happens is you get the bone on bone, and then the bone rubs, acts like sandpaper to the meniscus, and it just destroys the meniscus, so you end up with multiple tears. So they don't work anymore, and you need to get the knee replaced.
One more question.
Sure.
You mentioned about getting back to playing sports, and will this knee replacement help me improve my golf game?
Yes.
Take 10 strokes off.
That's right. That's great. Yeah. We'll play around after this, and then we'll do it before and after. Okay. Yes.
Yeah. So, anybody else? Any other questions?
Yes.
He's
another
got one.
question.
Dr. Hawthorne, everybody's much involved with fear, not only of pain and the bad news of bad history. I'm a 93-year-old retired physical therapist.
God bless you.
Oh, wow.
And but they also are nervous about the costs. Is there much difference between this new method and the typical?
Well, if you get a coupon, it's real cheap.
That's right. Check out on our website. Comes with dinner too. It's great.
No, the cost is very minimal. So,
I think that's good to know.
Right. That's very. Thank you for bringing that up.
That was a good question.
Yes.
When you say minimal, am I putting you on the spot, or is that tough to say because everybody's different?
No, it's the price to get the Visionaire is probably $100.
$100.
$100.
All right. Sign me up.
Wow. So I got $200 in my knees here?
That's to do the Visionaire, not the
Oh,
surgery.
right. Okay.
Oh, that's right.
Wayne's trying to get something for free again.
Right.
That's right. That's my
Fortunately, he already has knees.
That's
Right.
right.
and they're paid off.
Yes.
I heard there's a repo thing in there. If you don't pay it, they come get them and yank them out.
That's very painful.
Now, these new Visionaires or these new knees I understand that they're 2 pounds heavier than
That's the
my
excuse
old
he's
knee.
been using. He keeps telling me, I'm only 2 pounds heavier. It's because
No, it's a total of 4 pounds I can take off now,
Is it
right?
true?
Because I got 2 of them.
It's 1 pound. 1
See,
pound, Wayne.
you've been the scale. You need to fess up there, Pop. It's not all knees.
I'm trying here. I'm telling my wife I'm losing weight, and now you guys are blowing my cover.
We have a morning weigh-in. He's like, but you have to take off 4 more pounds because of the knees. And meanwhile, he's been adding a couple pad in there.
Now let me ask you a question.
We have one more question.
Oh, I'm sorry. Go right ahead.
Is there an age restriction?
Yes. Usually, you have to be younger than 90.
Okay.
Well, looks like she's about 45, so
That's right.
she's a good patient.
Sign her up.
Anybody else?
Hey, you look great, man.
Yeah. Wow. I'm 93. I want to look like that.
That's it.
Okay, we got another question.
That's it. That's my boy. You just came back from the villages, didn't you?
Do you do surgery on ankles?
Yes, do surgery on the ankles. Yes.
So would it be a replacement or?
Yeah, that's an interesting question.
Arthroscopic surgery. No ankle replacements.
Oh, okay.
Nice.
And that's even better. Arthroscopic surgery. That's great.
Yep.
I had my gallbladder done that way.
I had 2 arthroscopic surgeries on the knee. So yeah, and that's not very abrasive either, right? So
That's that's easy breezy.
Easy breezy.
Now, let me ask you a question. How long did it take you to learn how to do this? Did you have to go to any schooling or anything?
Yes, I went to the Hospital of Special Surgery in New York City
Gotcha.
and spent a week up there training, and then also worked on cadavers, and then went to Memphis, where Smith and Nephew is. Spent a week up there learning about the technology itself, and then slowly incorporated it into my practice.
Now, how does this work? Did you just decide that you wanted to do this, or did you apply to them and they selected you, or?
No, I decided I wanted to. I heard about it and decided that it looked like awesome technique to bring to Volusia and Flagler County.
We got more questions
And
too.
so that's what I did, and I'm glad I did. And there's a lot of people doing really well with their knees because of that.
Can you do your own knee surgery?
I can give myself a shot.
Phil, we got some questions online? Oh, in the audience? Okay.
You say do a show at the surgery?
Yes, I do shoulder surgery too. Rotator cuffs,
Wow.
arthroscopic rotator cuffs, and
We'll have a sign-up form after the show. Sounds
yes,
like
we
everybody
need to
just
make a list.
That's it. Everybody just needs to come see you.
Yeah, excellent. Any more? Anybody else? You got one more question?
No HMOs, but I take everything else. So I take every single commercial insurance, but just not the HMOs.
Gotcha.
Okay.
There's plenty of options.
Yeah. Yep. Whatever you need to do, I would. Oh, we got another question.
Is that something old?
No, the titanium is new stuff.
That's good.
They make planes out of titanium. Golf clubs too.
That's
Yeah.
right. It's very light, too.
I was flying up to upstate New York, and I went through the airport, and my knees set off the machines, and you gave me a card, which I gave to them, but they say they don't go by that. They brought some guy around and started feeling my knee, and I was watching him real close.
You were so happy that day.
Say, watch where you're going there, buddy. You're going to need a head replacement in 2 minutes if you touch the wrong thing.
And then I got in line next. Like, all right, my turn.
Well, this has been very informative, and I want to encourage people again. The whole purpose of this podcast is we want to create. Everyone's got the need to know, and that's what we want to do with our podcast. But there's a lot of talk shows on radio and TV, and they will get together and they'll talk about stuff, but nothing really gets done. And our podcast, that when we do them, we want to get some kind of an issue either resolved or help to get it resolved. And in the future coming up, we plan to have mayors on, talk about the traffic situation in Port Orange. Mayor Burnett said that he'd be happy to come on and speak with us. Mayor Henry of Daytona Beach has got some great ideas on how to revitalize the beach side. All the mayors that we've reached out to. Kristen, you're our news director. You're the one that's been talking to a lot of these people. But what we want to do with our podcast is we want to help get things rolling and get things done. And the knee replacements, where it might not be a civic issue, it is one of individual health, and this is one that there's so many people out there that need them. And how it seemed like all of a sudden this is a new style or something, a rash of them. All of a sudden, everyone's got knee problems, or has it always been like that and just didn't know what to do about it?
Everybody's getting older.
Everybody's getting older.
Not me. I'm not getting old.
We're all getting older, doing hard things.
American population is getting older. So it's just, and lots of people have been, active their whole life, and their knees are worn out. And the smart people that want to return to their former activities, things that can't do anymore, they get their knees done so they can enjoy life and get around and do the things they love. They're the people that don't want to give up the things they love.
Don't settle anymore. You don't have to.
If someone calls your office and wants to get an appointment, how far out are you now? Because I know you're very busy.
Very, very busy, but I have a policy that we try to get you in within a week.
Look at that.
Wow.
I have called doctors' offices where they say 3 months. So the fact that you're talking about within a week, to do your best to get within a week, that's fantastic.
Dr. Hawthorne, what's your website?
It's hawthorneortho.com.
Awesome.
Okay. If you're walking around in pain, folks, I don't care if it's your ankle, if it's your knee, your hip, your shoulder, whatever, there's no need for that. And there's really nothing to be scared of. This is fantastic. Dr. Hawthorne is fantastic. I'm perfectly thrilled with everything that he's done. I only wish I had something else that I need to go to him for, because it was this procedure, this visionaire was just a dream, and I feel so stupid for waiting so long. And
Don't wait. Get it done, and get back to your activities that you like to do, and get yourself out of pain.
That's it.
Absolutely. Do we have to? Let's go talk a little bit about Countryside before we sign off.
Yes, actually, you know what? We actually got some questions that came in prior to the podcast about Countryside Lakes, and we actually got the answers ahead of time. So I want to answer those questions that we received online. One of the questions was, does Countryside Lakes separate independent residents from those who are assisted living? And actually, Countryside Lakes is the only community in the area that does not require residents who receive assistance to live in a separate part of the building. This creates a closer community in which everyone knows each other, so that's a great thing. Another person had asked us through Facebook, what is the age requirement at Countryside Lakes? And actually, residents range from the youngest at 70 years old to the oldest, who just last week turned 104 years old, which is fantastic.
104 years young.
104 years young, excuse me. They do the axe throwing and all the different, they got a putting green out back. And lastly, somebody asked, what is the ratio of men to women? It's 75% women, 25% men. So men, if you're listening, the odds are in your favor. Come on over here.
Yeah.
That's right. I got some thumbs up over here. So Countryside Lakes, guys, you definitely want to check them out. And you want to go ahead and start living that resort lifestyle.
Pain-free.
Pain-free, and we appreciate them as our sponsor of the Lowdown podcast.
Okay. Dr. Hawthorne, thank you so much for showing up and talking with us, and hopefully some people are relieved and are going to be contacting you and getting their knees fixed. As for now, keep listening on social media. We'll let you know when the next podcast is coming up, and we'll be telling you all about that at that time.
If you have any issues that you think that should be addressed within the community that maybe is a podcast subject, feel free to email us at info@beldencommunications.com. And if you out there are listening and think, I'd like a podcast of my own, again, email us at info@beldencommunications.com.
Yeah, a lot of companies would like to have a podcast. We'd love to do it for you.
We have a lot of businesses that contact us, and we do those. So.
Okay, well, thank you for our audience that came here today. We really appreciate you showing up and asking all these questions. And Phil, it's time to go.
Let's go.
Thank you, guys.
All righty. Thank you.
Thank you.
That's a wrap.